I'm Dr. Vivek Badhe. I'm presenting scoliosis correction with O-arm imaging system and stealthstation navigation better than freehand technique, a comparative study. In surgical scoliosis correction, freehand pedicle screw insertion technique is challenging due to its 3D dimensional deformity. The O-arm 3D imaging with navigation system is reported to be more accurate for screw placement and to reduce radiation exposure to the surgeon. Between December 2017 and July 2021, 14 patients underwent posterior spinal instrumentation for spinal deformity using O-arm imaging system and stealthstation navigation. An intraoperative CT scan of the sterile surgical fields were obtained before the instrumentation. Instrumentation was placed and post-instrumentation CT scans were obtained before the wound closure to assess the accuracy of instrumentation placement and potential need for revision. A comparison group of 15 patients who underwent scoliosis correction utilizing fluoroscopy and freehand technique during the same period was evaluated. Evaluated parameters were age, accuracy of screw placement, effective dose radiation, and correction. This was the freehand technique that we utilized. A case using freehand technique, postoperative clinical results. This is the O-arm technique that we utilized. Correct. O-arm guided correction in a syndromic scoliosis. Postoperative correction. Clinical improvement. This is again a O-arm guided correction. O-arm guided correction in a syndromic scoliosis. So we found that there was statistically significantly less breach in pedicle wall in O-arm group. There was statistically significant high radiation to the patient in O-arm group as compared to freehand group, and less radiation exposure to the surgeon in O-arm group as compared to freehand group. Our results were consistent with the other studies. In contrast to our study, Jink et al. Reported higher radiation dose in O-arm group than in freehand group, though the statistical difference was not significant. Also, however, Jink et al. Reported significantly less radiation exposure to surgeon in O-arm navigation group as compared to freehand group. This result was similar to our study. So we conclude that the use of O-arm with navigation system increases the accuracy of pedicle screw placement in patients with scoliosis. Significantly decreases radiation exposure to the surgeon, but higher radiation exposure to patients as compared to freehand group. Thank you.